Look at all you guys in there. Hi, Amanda. Kim's in there. Hi, Kim. Michelle Hull. Hey, hey, tell Sarah to call me, Michelle. She wants to get a hold of me. Renell's in there. Renell, you've got to be tired of my voice. This is like 3 in a row. Tatiana, Victoria Wig is in here. Austin, hi, everyone. It's just all of our friends just show up. It's so fun. Hi, Rock. You can't talk to me right now. Where is my friend in here? Hold on. Hi, Tatiana. First time on one of our webinars? It gets a little crazy. It's fun though. You'll want to go sign up for all the rest of them. Hi, Victoria. Good morning. Where's my Zen? Brascarita, is it cold? Hi, Alicia. Oh, thank you so much. Oh, sweet words. We need those words sometimes. Where is Zen? Cold and rainy. I'm sorry. It's not rainy here today, which is a miracle. But it's still, 44 degrees. Stop it, Arizona. Michelle's just on here bragging. She's got the heat. Zen's in Florida. She's got the heat too. What is, hold on, guys. I got to figure this out. Oh, it's the same one. Okay. Ooh, a lot of people coming in now. Yay. I can't let you guys talk to me right now. I apologize. Do you guys have these little kids that listen to the same song over and over? So now I have one of my little nephew's songs stuck in my head. San Diego, don't brag, Jessica. I'll be in California in a couple weeks. Then we can brag. Okay, where is he? Kansas. All right. Where's my Zen? Okay, guys, I'm gonna mute myself for just a second and try to find Zen, okay? Hang tight. Sorry, guys, I was on mute. I wasn't ignoring you. I was just talking to my friend Zen here. I promoted her to panelist. Sometimes it takes just a minute. Hold tight. Oh,
And
sorry.
then I'm gonna need access to
Hi.
hello. I'm gonna need access to share screen. So let me go ahead and pull that up real quick. Wait, where are we?
There you go. You should be able to do that. See if you see it, Cheryl. Yes. Right now.
Oh, shoot. I just lost you. Hold up one
I'm here.
second.
Seattle, Marianne Pepper in the house. I see you.
Okay, share screen. Let me just pop up here real quick. Okay, and then I need to go here,
Good afternoon, Deborah.
and then we're gonna go.
You got it. You got it. You want to do it first?
Oh, no. Okay, I'm prepped. I'm ready. All set.
Okay. Can you take your screen down for just a minute?
My screen down. Go off screen.
Yes. Can you unshare just for a second, please?
Unshare. Yes.
Philadelphia. Hi, Victoria Kribner.
Oh gosh, how do I unshare here?
There should be a button when you scroll over. It just says unshare.
Share. Stop sharing. There we go. Okay.
There. Okay. So let's start. It's 9:02.
Not too bad.
Amanda Mazurzen. You guys, she's my biggest fan. No one could love me as much as Amanda. Well, maybe you, Zen. I do love you. Okay, Amanda's in Portland. I'm heading there in a week. Wow, they're from everywhere. How many people? Right now, Zen, we got 91 in attendance on here.
Wow.
You guys, this is a special treat today. I'm going to tell you a little bit about my experience with the wonderful Zen Miller, and then I'll have her introduce herself in more of a formal manner. But I love this lady. She helped shape what I'm doing, what I decided to do in my treatment room. She taught me all the holistic treatments I use. She had a signature facial I had used at one time. She's an amazing instructor. She's going to say all the words properly to you, use all the terminology, use all the big, like she teaches at a level that we should all be learning at. And I'm going to cry about it. Our friendship through the years has just been incredible. Now, my friend here, she was out of the industry for a little while. And I honestly counted the days until she returned. So
oh girl, now you're gonna make me cry.
We're so happy to have her with us today. You guys will learn a tremendous amount. An incredible human and wonderful at everything she does. And wait till she tells you all she does. It's crazy what her life has entailed. We all wish we had exciting lives like Zen, but mine's kind of boring compared to that. But she's wonderful. And today we're gonna talk about remedy rehab a little bit, or oil that we all love. I'm gonna take 7 minutes and get this over with. And then I'm gonna hand it all over to Zen because she's gonna show you guys amazing. Sorry, I have glare in my glasses. She's gonna show you guys amazing things to do with our stainless steel tools. She also, yesterday I get this email. She has created a document for you about the stainless steel tools and just information about them. That's phenomenal. So I'm going to try to attach that to our Zoom email that we return to you. However, if I can't do that, I'm going to put it on our Airtable link. And most of you have that link to Airtable. Sorry, now I can't see. But there's a few of you on here that are new. Tatiana said she's new. Make sure you email marketing@Hale and Hush. I'll show you it in a second. And then I'll get you that Airtable link. You'll have access to lots of cool things, but I'm going to start a document file. That was perfect that she sent it to me. I'm going to upload it today. Okay, so we'll try it both ways and see what happens. Your link will come directly from Zoom. So I'm not sure if we can do attachments. I'm going to try. Actually, I'm a liar. I'm going to have Morgan try, because she's better at it than me. So today, of course, it's a webinar. We're giving away free prizes. You know how I get really excited about it. And so what we're going to give away today, I love the blur. Don't you guys love the blur? Is a back bar remedy rehab. We're going to give 3 of them away randomly. Morgan's going to be on here checking names, putting them in a little calculator, popping out whoever wins. So if you do win, you have to email me with your address, because I don't have access to the addresses at the office. They don't allow me your credit cards, bummer, or your addresses or the personal information. So you have to just email me where you want it sent, and I'll get it to you next week. Okay. And Victoria Krippner and Victoria Wig, you cannot win. Sorry. You have access to enough of it. Okay. So I'm going to share my screen real quick. I'm going to get it over with because I'm not interesting. This other lady is. Actually, no. Zen, please introduce yourself to this wonderful crew.
Okay, well, first of all, thank you for having me here. It has kind of been a dream of mine to always be a collaborating educator with different lines. And I told Shauna the other day, I really only want to work with lines that I'm absolutely in love with. And Hale and Hush is for sure, 100% one that I am in love with. I'm from Seattle and recently moved to Florida, and I can just tell you the skin conditions down here are so perfect for Hale and Hush. So I'm grateful every day that people can come in, and I feel really confident to be using these products on the skin down here that's really, really trashed. Anyway, my name is Zen Miller. I am coming to you today from Jacksonville, Florida, and from the Zen Lounge. And so I had the Zen Lounge 25 years in Seattle, and then picked up during COVID and moved down to Florida. I have not looked back, have not missed the rain. But anyway, opened up a new spa here. And, many of you might understand this. If you've been solo for a while, you don't know what the future holds. I came here, no job or anything, but I just had a dream. And every day I manifest that dream. And this is part of it. So here I am, super excited to be with you. But like I said, I'm in Jacksonville, Florida. My background is I am a U.S. Air Force veteran, and in the military, I served 20 years as a cardiorespiratory therapist. And in that facility, it was everything heart and lungs. It was death and dying every day. I realized two things. One, I love the body. Two, I don't like people dying. So I wanted to kind of turn that around a little bit and figure out a way I could help people live and be healthier and better. That experience kind of helped me become a holistic practitioner, and I certainly embrace holistic lifestyles in every aspect of my life. So yes, in the U.S. Air Force, I'm also a fitness instructor. I've taught around the world, even on cruise ships. And so here in Jacksonville, I've got my own Pilates studio. I teach all different kinds of fitness, but I love Pilates. And it's functional, so as we age, we lose our balance and everything. So here it's fitness over 50 classes. It's absolutely magical. And it's going to be online soon. So if you're feeling broken, this goes out to anybody. If you are feeling broken, right, this is how you stay balanced and healthy. This is how I've been in the business almost 30 years doing massage and skincare, right? You got to counteract all that repetitive motion that you do. So yes, I am fitness instructor 37 years, and I am also a massage therapist. I've been a massage therapist 27 years. So each progression, right, I'm like, oh, I love the body. What else can I learn? What else can I learn? What else can I learn? And it all just kind of fits together like a glove. So next on my list was skincare, and I've been a master esthetician for 17 years. And so I put all of my loves, all of my passions together, and they go into each other so beautifully because I have that really in-depth understanding of how the body functions on the inside. I see so much through my fingers. These are my really, really, really magical tools. I don't need anything other than these, but I like to have enhancements. And that's what we're going to be talking about today is our steel tools. I cannot wait to share with you. Back to you, Ms. Shauna.
Okay. Isn't she awesome? Just be like her. And by the way, I want you to know this isn't about her fitness class, but I was the first to sign up. So if anybody else wants to try it, haha, I was first. But it's great. I'm gonna share this. Just so many people in the chat, Zen, are just loving it. Love everything. You're gonna have to I'll have to give you the link so you can go back and read all of their cool comments.
Please do. And thank you all for being here. It's just such an honor.
Oh, and someone sees the healing instruments behind you.
Oh, yes. Oh, yes. Trust me, this is it. This is my place of healing. It's my sanctuary.
She does more than you can even know from one human. It's amazing. I'm going to share my screen. Mine is simply boring a little bit. We do have a few new people in here. So I hope to get a few. Where's my Zen? There it is. I'm just gonna, if you're new here, I'm gonna talk a little bit about our Remedy Rehab Oil, just so you know. I don't want Zen to have to waste her time on ingredients and how it works and those kind of things. So I'm gonna blow that out real quick. If you guys are all in the chat, it's awesome. If you have a true, real question, please put it in the question and answer so I can differentiate between the two, okay? Because the chat sometimes gets a little overwhelming for my brain. Remember, fitness over 50. It's get you in the brain too. Okay, so today, here's a little bit about the program. I wanted to throw this up there. Do you see the email marketing at Hale and Hush? That's where I'm going to put Zen's document today about the stainless steel tools. Okay, you just email that. You'll have access then to all of this, our free monthly program, our website photos, our free social media quarterly content that Morgan's created for you. You can go to our website and there's 10 more, I think 10 more free webinars this year to sign up for. And then of course our blogs, I just wrote one on skin immunity and the function of the skin barrier. That should be up shortly. We have the YouTube channel, which after we do these webinars, they're put on our YouTube for you to view. We have a scholarship program. Guys, please stop what you're doing. Go get the link to the scholarship program from our social media. Chris Campbell is giving away 4 $1,000 scholarships and product this year. She's just that way. You can ask Zen.
Oh, yes.
Chris gives everything away.
Yes.
But I don't have a lot of applicants. There's probably only 120. And so please go apply and fill it out completely. If you miss a box, it's thrown out. Please fill it out completely. Yeah, that's it. Our Remedy Rehab Oil is one of my favorite products. No, it's a lie. It is my favorite product.
Nice.
I love this. If I could dip my whole body in it, I would do it. Chris won't sell it to me in that size container. She just sells me these over and over and makes $1 million because I just buy them. But I love it. It nourishes, it calms the skin, strengthens the barrier, which we always talk about barrier function, helps with hydration, moisturization. It really does boost the resiliency of the skin and the elasticity. It's also good for acne. People always ask that question. It's non-comedogenic. On dry acne, it's lovely. On acne that is more oily, sometimes clients just don't like the feel. It doesn't mean it's going to harm the skin. They just don't like how it feels. Okay. And it really rehabilitates the dry and dehydrated skin, which right now we're in a seasonal shift, which that happens a lot of the time. And it really does help with wound healing, which all the different oils in it are amazing. Here's all the oils. We got jojoba. We got a lot of squalane in there. Watermelon seed oil is amazing for hydration. Really helps that factor of the tool, you know, the transepidermal water loss. And people never think about watermelon oil. So I love having a different ingredient in our products. Sacha Inchi is wonderful. Meadow foam is the one that is good for acneic clients. Calendula is one of my favorite oils of all times. And sunflower. So it comes in a 1 ounce little dropper, ding, ding, and then a 4 ounce Big Daddy. Now, people don't like the pump on this big one. Just fill it, people. Just take the biggie and fill the little. It's fine. Just don't get it contaminated in there, but you can do that also. People want a bigger dropper, and I think it would just be a mess. So this is what Chris has done. You can use it all over the body. Like Zen today is going to show us the holistic treatments on the face, neck, and décolleté. You can do massage. People have done it to dermaplane, although it does absorb quickly. So if you're going to do it for that, you have to use a little more, okay, on the skin. Added to any routine, like I told you, I put it in mine. I put it in my treatment room. People mix it with the moisturizer. I use it on all over my body. I just love this. I can't even say enough about this. It is fragranced with natural sage and eucalyptus. That has been the only negative thing we have heard. Some people don't like eucalyptus. I love it. There's our tools. I'm not going to talk too much about this because Zen's going to really go to town on this one. What I like is I can't break these. That's the bottom line. I've shattered 6 of the pink rose quartz gua sha tools in my career, and I'm glad I don't have to shatter any more gua sha tools. Okay, she's going to go into more detail on this. Here's the rest of the year for all of our webinars. You guys got to sign up. Only 500 allowed in each. We have 420 today. So if you don't sign up, they go like crazy, okay? Those are found on our website. You guys all know this. You know why we're good. We're just good. That's all. Can you just say that? That's kind of weird, right? No minimums. No, we help you drop ship. We have education like we're doing today. We have 18 products. 2 more coming by June, guys. 2 more. Ooh. 2 new weeks. Maybe even a 3rd by the end of the year. I don't know. I'm not telling any secrets. But stay tuned on that. You guys will love it. Those of you who are new, you guys need to get in a PK class so you can get all of our information, or that free 45-minute welcome call is available to you. Again, go visit the website. This is my email. Your emails are coming directly from Zoom from these webinars, but if you need me, that is me and my phone number. If you need me. Okay, so see, told you I was boring and now I'm done. And now for the fun part. There's already a question. Let me see if these questions pertain to me. Yes, Amber, there's a 4-ounce back bar option of the Remedy Rehab. Yeah, done. Okay, you mentioned acne. Do you think, yes, severe eczema? If the skin is open, it will stingle. So careful with that just because it's open skin. As it heals, yes, it's beautiful. It does rebuild that skin. Okay. Would the oil be an option for pregnant clients? Yep, absolutely. Unless they hate eucalyptus. You know how they get all smelly. Question with food allergy. Yes, patch test first, Marianne. If you, the watermelon oil is really different from fresh watermelon. I would definitely patch test, but those two things, they not really the same, the way it's formulated, okay? But patch test. I can't make the PCLAT on Monday. Oh, JC, I don't have my calendar in front of me, babe. If you could go to the go to our website, it'll tell you all the classes through July, okay? And Tay, there will be for you, it'll be sent to you by email for a replay. Otherwise, in 2 weeks, it will be on our YouTube. Okay, if you have a friend that missed it, aha, you get to see it first. Okay, are we ready?
I'm ready.
There you go. It's all you.
Okay. So it is saying that my connection's a little bit unstable. So if I freeze up, just give me a shout out. Hey, frozen. And so then I'll just pause and okay. All right. Hey,
Great.
everyone. So we're going to be starting. Let me give the.
Oh, she froze up. There we go.
I talk fast and I speak very anatomically correct. If you don't understand what I'm saying or you need me to repeat anything, let me know. Otherwise, I'm just going to kind of be plowing forward ahead. We're going to do a quick little A&P video, and then we're going to talk about the tools, the benefits of it, the indications, contraindications, how to clean it, how to mix it up and make it super fun. So that's what I hope to do today, is to really help motivate you to create some new combinations in your class. And then we're going to be going through the technique as well. Okay, so I'm going to go to a share screen. Give me just 1 second here. And I'm going to pull up a little A&P video. We're going to be talking about it real quick. All right, so starting at the very base level of your skin, when you are working with steel, the first thing that you need to know is that if you clunk it against these bones, it's going to hurt. So you need to be very confident and slow in the maneuvering of these steel tools. Anytime that you are around a bony prominence, your jawbone, your zygomatic arch, the hollows of your eyes, even if you hit the cartilage on your nose, it does not feel good. So just being really aware of that. Also, too, when working with any tools, not just steel, anytime you get to a joint, you really want to lighten up that intensity. I'm going to have everybody do a little exercise right here. Find your ear hole, put 2 fingers right in front of your ear hole. I want you just to close your eyes, and I want you to open and close your mouth. And then I want you to take your fingers and I want you to walk around that joint. Pay attention to see if there's any discomfort in there as you're opening and closing your mouth. If you're feeling any tightness. Anyway, this is our temporal mandibular joint. You can go ahead and take your hands down and open them up. Now, all I'm saying is when you get to this joint, you better lighten up because it doesn't feel good for anybody. I'm going to give you a couple other things as we go along as well. So make sure that you really pay attention to these areas that you need to go lighter on, especially with steel. And especially because these are weighted tools. So don't ever feel like you need to press down. The weight of these tools is enough for the tissue and the depth that we need. All right, so starting at the base level here, next we're going to go into... Takes here just a second to transition. All right, this is the muscles. I'm not sure if you're very familiar with them. Again, I speak very anatomically correct when we're going to be working around these muscles. But if you're going to be touting yourself as a contour specialist, or if you're going to be lifting and toning, you need to be really, really aware of what these muscles are, which direction the striation of the muscles are, the way they're going, so that you can sculpt and contour these muscles precisely, being the master that you are. Even if you're doing like some temporal work, just knowing that that temporalis is this big. So you need to work that entire temporalis if you're trying to get rid of headaches or soften and relaxing the crow's feet. So be familiar with the muscles. If not, I teach a great class on it. Next up, we're going to be looking at, all right, so this is our nervous system, and I'm going to talk about a couple real important things here, so I want you to listen up. I want you to find your earlobe right here, okay? Slide one finger very softly behind your earlobe to the lateral edge of your jawbone. Do you feel a soft little spot right there? Yeah? Don't ever touch that on your client, okay? So as you can see there, you see that little focal point and all the nerves go out? That's right here. And the nerves come out to our face, like so. So we've got nerves that lift our eyebrows, nerves that close our eyes, nerves that make us smile. Our muscles in our face are different than our body because we've got ligaments and tendons in our body. But in the face, the muscles move by nerves. That's why when you get Bell's palsy or you have a stroke, you lose that nerve sensation, you lose that muscle movement. Now, if somebody comes in with that, guess what? Your steel tools are going to be amazing for that. But back to the nerves, right? So they kind of go like this. There's a lot of nerves in the face. And you know what? Speaking of, if a person comes in and they've had facial surgery, a year ago, I had some facial threading done and they trashed my nerves. And I mean, trashed it. I had zingers all over. I couldn't sleep for 6 weeks. So you got to really, like, I never had such honor for nerves as I did after they really ruined them. And any type of procedure that you have is going to really mess with your nerves. Anyway, a couple of things that are super, super important. Say your client comes in with trigeminal nerve pain. It's just this throbbing pain right here, right? You need to ask yourself, would a warm therapy or would a cool therapy be better for her? And I'm here to tell you, anytime there's any nerve, whether it's hypersensitivity or decreased sensitivity or inflammation within the nerve or decreasing of the nerve, you always want to go warm. When a person feels cold on a nerve, it shoots through their entire body as pain. All right. So there's going to be reasons why we would use cold, but this is one of the reasons why you would not use cold on a person's face. And that's if they've got any nerve inflammation. All right, gonna go ahead and move on here. Next layer in our face, we have got, all right, this is our vascular system. So this is the red ones are gonna be our oxygenated blood. The blue ones are gonna be our deoxygenated blood. The beauty of the steel tools is today that we're gonna be working on, the reason I love most is that we can do contrast therapy. And when you are working with a warm or a cool tool, you need to be very aware of the vessels that you're going to be working on underneath. So let's just talk about, say, like telangiectasia, rosacea, anything where you've got broken capillaries, right? You're going to want to bring cold on there. Cold's going to decrease it. So we can use our tools very effectively that way. Say they've got like a throbbing vein right here in the forehead or coming up right like that, right? It's just kind of big and bulbous. That is an injured vein, right? You're not born with those. So that means that vessel is already deconditioned. It's already strained and having to work hard. And so it has to like kind of pop out because the vessels of it are weak. So if you see any veins that are above the surface of the skin, like maybe you can look through the skin and see them, but if these are above the surface of the skin, you don't want to add direct pressure on it, especially not with a weighted tool. So if there is any distension of the veins, this is on the neck, this is on the jaw, forehead, anywhere, do not add direct pressure. You're going to be causing that vein to really be worse. So that's going to be it. So for if a person is coming in, oh, they're very yellow looking, or they're looking pale or white, they are more ischemic, meaning they're not getting good vascularity to their face. You're going to want to use a warming sensation on them to really open up everything. But if they come in and they're sunburned, everything's already open. So we want to use cool to calm it down. So that's how I incorporate these tools into my thermal contrast. And honestly, I love it. It adds just that little element of kind of like a surprise or just a really nice treat. Not everybody loves cold, not everybody loves warm, but I vacillate back and forth. And the reason why I do that is for a vascular flush. So when I use a warming tool, that's going to open everything up, vasodilate. When I use a cold tool, it vasoconstricts, brings it down. So I want to open it up. I want to flush off all that metabolic waste. If there's any puffiness on the face, I want to flush it off. I want to do some manual lymphatic drainage. I want to do my rollers. I want to do my contouring. And then I want to cool it down at the end. So everything is locked into place. All that fluid is now pushed down into my lymph nodes. So that's it, the vascular system. Look at how much there is in the face and be very aware and honor it. All right. Again, make sure that you do not do any direct pressure over any distended veins or arteries. All right, moving on. We're almost done. I know there's a lot to it, but this is all real important. This one I'm just going to glaze over. These are acupressure points in the face. When we're doing these rollers, we roll over them. This is, again, reflexology. The face, we are accessing all of when we're doing these rollers, we're accessing all of those reflex points on the face. And there's a million different versions of it, but all of them connect to our body. So when we are rolling and we're contouring, right, we're affecting every organ in our body. So just know that. And the reason why you would need to know that is, say they come in with high blood pressure, and we calm and relax everything down. We get all their organs moving, their digestive tract moving, their lymph flowing like that. And then they stand up, they could pass out or something. So you need to kind of, if their blood pressure drops too much, you just need to be aware of the changes that happen in their body. It's just like when you get a massage, you get up and you're like, oh, I'm so thirsty and I could eat like a steak. That's because everything speeds up. Like when you're doing manual work, it speeds up the processes in your body, especially when we're doing reflexology points on the face. Okay, so this little compartment right here, you might not know what it is, but this is the fascia of the face. Now, fascia is a very mobile, right? It is a very fluid piece of tissue that wraps around muscles and helps that muscle kind of stay in shape, right? Like I've got my retinaculum here, kind of pulls all the muscles of my forearm in to meet my hand. This is what fascia does. It kind of compartmentalizes and keeps everything in its place. The difference is in our body, we've got like different layers of fascia. It's more deep. It takes like a big stretch. On the face, you can see they're itty bitty, and it's very a very, very shallow fascia. So let's just talk about the way that it's kind of layered. You're going to have your skin. You're going to have your lymphatic system. It is literally right below that. You're going to have your vascular system. You're going to have your fascia. You're going to have your muscles. So when we're doing these techniques, we're working it all. All right, moving on. I think that might be it. Oh, no, what I'm talking about. Lymph. These are our lymph nodes, all right? In front of your ear, behind your ear, right? A lot of people don't get these subocciput ones. Right here along your SCM, and a lot underneath your mandible, and also right here in the jaw. So it doesn't matter what you are doing. It doesn't matter what service you're doing in your treatment room. You need to start with the lymphatic drainage, because if you're manipulating the blood or anything like that, you need to open up those pathways so that metabolic waste can be flushed out of the system and doesn't settle right back in, causing puffiness, causing swelling, or bringing garbage to the surface. So the first thing that you do in any service is starting with the lymphatic flush, which is what we're going to be doing today. And yeah, just on that note, real quick, we are going to be doing a lymphatic flush. And one thing about a lymphatic flush that's really important is that I wouldn't start flushing lymph from here, pushing it down and pushing it out, because there's a lot of points where it could kind of get congested along the way and then causing like a backup, right? You just it can't move. So the way we're going to start it is we're going to start by opening up these ports that kind of drain down to their subaxillary lymph nodes. So we're going to be starting here and we're going to be draining to here. Here's the thing about lymph nodes though. If you're doing any oncology work, which I know a lot of us are, it's going to be okay. There's like a million ways that lymph can kind of get around it. So if you've got a person who has had some lymph nodes removed, they have to have some in there or they wouldn't be able to have return from their skin. So you're going to be okay to do this. It's going to be okay. But if they have those lymph nodes removed, it's going to be like scar tissue in the area, just be from the incisions and stuff. So this is actually a really good technique just to soften the scar tissue and to soften the muscles to create better vascular and lymphatic flow. Okay, I think that's it. Any questions before we move on?
There's none in the question box.
Perfect. Okay, and then we'll just do the skin. All right, so I'm going to go ahead and take the screen down. I'm going to stop sharing. Stop sharing. Okay. All right. Let's see. So let me just start from the top. Steel tools. I absolutely love these. And as a massage therapist, I've worked on a lot of kind of vascular treatments over the years. And it started kind of with, all right, say you've got your little, how many of these have you broken, Sean? All right. You have these. Now you can cool
Many.
these and you can warm these, and it's going to feel nice for about 10 seconds because my hand is now transmitting all the heat in here. And I can hold it like a little, no. And this is, it's not a good conductor of sustained warmth. So then I went to like hot stone massages, and these stones are very thick. It's a basalt stone. It's meant to kind of keep heat in. Here I'm going to get about a minute, and the ones I use for the face are this size. Here I'm going to get about 30 seconds worth of warmth. So if I need like a spot treatment, just a real hot, I'll put it on there. But the thing I love about these steel tools is they're going to keep that heat for such a long time. And the bot, if you're using it, it's going to keep it warm. So whether it's warm or cool, you're going to have approximately 3 to 5 minutes worth of sustained cooling or warmth. So now we're just going to kind of talk about the benefits of these tools. We're going to be doing some lifting and toning and sculpting with these. So that's why it's important to know when we're sculpting, the areas that we're going to be touching and how we can manipulate those muscles, how we can release temporal mandibular joint dysfunction, jaw pain, how we can drain the sinuses. That's going to be kind of our contouring part. Using it cold after you say have steam on their face, put a product on, it's going to kind of vasoconstrict all the pores, so it's going to pull in all the nutrients and keep them in there. It's going to decrease, if you use it cold, it is going to decrease any vascularity on the face. So this is a treatment that I do if someone has a special occasion coming up, if they're having photos or weddings or anything like that. This is going to be like a treatment I do cold on them to really decrease that vascularity in their face. Again, if I wanted to increase the vascularity, I would be applying warm to their face. It can be done during any part of the facial. Now, Shauna was talking about the oil, which is fantastic, but I want you to start thinking in a different terms. Say you've got a cleanser on their face and you bring in a warm, a warm roller massage, right? It's just going to change the way that cleanse goes. Same if you've got a serum on a face, or even the Hush Hydrate Gel Mask. Put that in the refrigerator, apply it cool, and then do a warm roller on it, like just kind of creating that vascularity. So the skin just tingles. It feels amazing. I also love to use it with an oxygen mask. But it can be used any part of your facial with any product. And again, as Shauna said, the nicest thing is it's not breaking. That's the best. Absolutely. That's sold. I'll buy it all day long. But again, just make sure that, you wipe your hands before you grip these tools so you don't lose your grip when you're on your client, because they are heavy and they do hurt when they fall. Not that I know. No, I do know. I've dropped one on a client. Trust me. If you think it has happened, it has definitely happened in my room. All right. So it's going to call. So it can be used again, warming it up, vasodilating. We're going to flush out that metabolic waste. Cooling it is going to kind of close everything down so that we keep all that metabolic waste out of there. It's going to reduce sinus pressure. So say your client, like here in Florida, like every car is yellow because there's so much pollen. Everybody is swollen in their sinuses. So we're going to learn how to do a little sinus drainage, but first we're going to learn on ourselves. So put your hands, put 2 fingers in the air, wave them around like you just don't care, turn them into your body. And see the cherry of that zygoma? You're going to go push straight up towards the ceiling. It looks really pretty. And then just take some nice slow deep breaths in and out of your nose, right? So you're lifting your skull off of these inferior sinus cavities, and it is going to drain down your throat if you've got some puffiness in there. Maybe it's congested, right? Maybe you want to put a steamer on there. Now, this is how you do it on yourself. This is how you do it on your client. Like they're laying right here, you just pull it towards you. All right, do that for a couple times. Now take your thumbs, bring it to the most medial edge of your orbital bone, so that the pad of your thumb is right there. And then you're just going to lift it straight up towards the ceiling. And again, take a couple nice slow deep breaths out of your nose. So here we're getting those superior sinus cavities to drain down. That's another reason why we need to get those lymph vessels open, because if we're draining mucus, right, they got to have a good pathway, a good clear way. Anyway, that's how we do that. We hold it 4 or 5 seconds, release, and I do that a couple times. You'll get familiar with it. You'll start to feel it. You're going to be like, oh, this side is more impacted than the other side. Maybe you feel it on yourself. One other good thing to know is, sorry, checking time. One other good thing to know is if your client has a sinus infection, one, it's not a good idea to get a facial. But two, if you do this, they will be in agony. If that happens, have them stick out their tongue. If they've got white stuff on the tongue, you're gonna be like, nah, sis, you got an infection. You need to go. So anyway, just be very aware of that. Like if they've got tension up in this area, work it lightly, and then just working always with these, because they are heavy, always to client tolerance, always with a secure hand so that you're not clunking into bones and you're not dropping the tool. All right, so yeah, decreasing any sinus pressure or puffy eyes, right? If we clear these bottom sinus cavities, oh, again, so when it's on my client, I pull it this way, and then I'll stick my middle finger, I slide over their forehead, lock it right here, and then pull it towards me, towards my chest. That's how I drain it. Now, here's one other thing too. When we're sitting here, if you felt any sinus drainage, it's going straight down your throat, right? But when our client is supine on our table, it's going to the back of her throat. If you see your client doing that, you know, give them some water, let them spit, whatever it takes. But but you want to drain it, so just be aware that that could happen if they're on your table. All right, so here we are. Calming the nerves and the muscles of the face by using it warm. All right, so that's going to give us that nice calming sensation. Those muscles, it is great. If your client comes in with any temporomandibular joint dysfunction, muscles right here. Actually, let's do this. Take 2 fingers here. Find your joint, right? Open and close. You can feel that under your fingers. And now just slide straight down. And we're just going to do little circles like this. This is what we're going to be doing with the mushroom. And I want you to close your eyes, and I want you to decide which side of your jaw is tighter, the right or the left. We all have a dominant arm, a dominant leg, and we have a dominant chewing side. When you can identify that into your client, it feels like maybe you're a clencher or a grinder. You've got a lot more tension on this side. When you can connect with their body in a very simple manner, just to identify what's happening in their jaw, work it out, create balance in that jaw, they're going to have a whole lot better lymph flow. They're going to have a whole lot better muscle balance. Trust me, it's priceless. That's a big tip right there. Anyway, hopefully you found one, right? So now maybe you know which side is tighter. Now maybe you need to roll it out. Here's the thing about jaw pain, right? This is the strongest muscle per square inch in the body, the strongest. You know, and how much do you talk? How much do you chew in your day? It's a lot. So it gets really quite a workout. So doing self jaw work is really good. And it feels incredible with the warm, right? But maybe they're coming in and they've got some inflammation. Maybe they had their wisdom teeth pulled. Now I would want to use cold on them. I'd want to decrease that heat and inflammation in the area. But this is a really, really good area to get super familiar with working. And you know what? A lot of people now, they're thinking they need to be all inside the mouth and doing this, all this stuff. It's not necessary. You can work all of these muscles externally without any discomfort to your client. Trust me on that one. I don't know. It's a fad, I think. All right. So the best thing also about this is these techniques really just take a couple minutes and they really elevate your facial. It requires no downtime. These are going to be great after surgery. Like one thing I really specialize in is jaw surgeries, whether it's elective or, you know, say they've been in a bad accident. So really being familiar with that facial anatomy and knowing how to calm and soothe these things, it really makes you valuable as an esthetician, allows you to go to surgeons or anybody and just say, this is what I specialize in if you need it. Because trust me, when you get any type of facial procedure, as soon as that procedure's done, if you have a problem, the surgeon's like, yeah, sorry, I just did the procedure, right? There's nobody really there to take care of you. So that's the role I fill. Come on in, let's get that scar tissue balance. That's another thing that we can do with these is to warm scar tissue. Scar tissue is really just collagen, but it's laying down quick. It's trying to get strong, right? But we want to smooth it out like that so it lays flat. Here's a true story. Had a lady come in. She had a facelift, right? And normally they kind of do, you know, behind the ears tuck. I don't know what this doctor did, but she had a scar right here on the edge of her hairline. And then she started to keloid scar. That's where it goes above and wider then. It started to close her eyes. And she comes in and I said, sis, come in, I can help you, right? And so I do these scar revision techniques using warm little massage movements. And then I come in and I'll use a cold one to get that scar tissue to lock in place. Anyway, we worked on it for a while. And so she ended up having to go see another surgeon because the doctor's like, yeah, come back in, I'll fix it. And I'm like, no, girl, you are not going back to him. You better stop So if any of your clients are thinking about a facelift, help them do their homework. All right, let's see. If you're going to be doing any scar tissue work, and I highly recommend that you do because these tools are just magical for it. I have a complete separate service. It's just scar tissue remodeling. On any part of the body, scar tissue remodeling is exactly the same. So if they come in, C-section scars, broken, anything, you can help them heal, right? You can help that scar tissue alignment. But you have to wait 8 weeks, minimum of 8 weeks before we start doing any scar tissue remodeling. And I'll tell you why. It's forming together and it's very soft and it's pink and it's dewy. If you press too hard, it will separate open. I've done it. It's horrible. So wait 8 weeks and start really, really lightly, but you want to start as soon as you can so that you can really get it to lay flat and look beautiful. All right, these tools can also be used over any type of mask. So that whether it's a product mask, perfect, silicone mask, any type of mask that you use, these are magical, either warm or cold. I absolutely love to incorporate all temperatures in every aspect of my facial. Let's see, it's going to improve your immune system again by opening up those lymph vessels. Okay, I do want to talk about just a couple reasons, indications, who we would do this for, who we would not do this for. The reason why we would do a cold service, if they come in with any lymphedema, right, and they're cleared by their doctor, we would want to be using cold on them. If they are post-operative or post-traumatic edema, meaning swelling on their face, again, medically cleared, we would want to use it cold. And again, there's a manual. You don't have to write this down. I want you just to listen. All of this is in your book. It's important to know. If they have chronic venous insufficiency, meaning they are ischemic, right? Or they're not having enough, you would use it warm. If they're having muscle spasms, right? If there's heat with that spasm, you would use it cool. Or you could use it warm, but it's going to be an indication for both spasms. If they've got sinus congestion, you would use it warm and then finish with a cool. If they've got congested complexion, you would use it warm. This is going to soften the oils in the skin and make extractions even easier. Use it warm. Give that oil time to warm up and it'll come right on out. If they have rosacea or hypervascularity, you would use it cool. You want to bring it down. You want to vasoconstrict all those vessels. If they've got tension headaches or sinus headaches, you're going to want to use it warm. Actually, each person's a little bit different, warm or cool, whatever their pressure, whatever they prefer. If your client has hot flashes, let me tell you, they're going to want to take these bad boys home because it feels amazing. They do it on their temple and it cools the whole body. Let's see, if they've got any temporal mandibular joint dysfunction, again, some like it warm, some like it cold. I generally work it warm, but just softening and relaxing those muscles. And again, that can be from clenching, whether you're awake or you're asleep. If your teeth don't line up, if you've got malocclusions, right, you can change that balance in their face. Skin laxity, warm or cool. If you're doing any waxing or peels or radio frequency or anything that's going to cause inflammation, get these on as soon as you can. It's going to bring that inflammation down. That being said, maybe you don't want to bring that inflammation down. Maybe you want to increase the inflammation to speed up the healing. Use them warm in that instance. Everybody's a little bit different. And then if there's bruising, use it cool, just real gently. It's going to help push off any of that blood. All right, reasons why we would use it warm. If you're looking to flush metabolic waste, if you're looking to soften muscle tension, if to warm the oils, to get rid of headaches, to detoxify the skin, it's great. If they've got any nerve pain in their face, put it warm. They're just going to love you for it. This is going to warm. It's going to lower, it's going to calm their central nervous system, lower their stress levels, lower their anxiety levels, mix it with a little essential oil, put a drop of essential oil on and then do warm over it. It just absorbs into their skin like magic. It's a really, really nice way to utilize that. If your client is chronically cold, right? Come in there, do it at the base of their neck. It will warm their whole body. If it's a hot, stinky, swampy day like here in Florida, put it on their cold and it will just really stop them from sweating. So it's these are just amazingly functional tools. Okay, so there are some hard no's. These are going to be complete contraindications why you would not do cool or warm therapies. If your client has cancer, don't do these techniques on them, right? We're not sure where we're spreading it to. We don't want to cause any, stress onto their lymphatic system. We don't want to cause any stress into their cardiovascular system either. Just don't do it. If they've got congestive heart or renal failure, right? Heart or kidneys, right? If we're going to be doing a lymphatic flush on them, a pretty significant one, we want to make sure that they're healthy enough to have the service. If they have deep vein thrombosis, just, be aware of that. If they have deep vein thrombosis, a lot of times they're going to be on Coumadin, a blood thinner, all right? This is the biggest one. If there's one thing that I need to impress more than anything, if your client is on Coumadin and you are using these tools, you need to be as light as a feather touching the skin, or you will bruise them. They're like 10 times as likely to bruise. And it's not just a little something you can just kind of flush off. This is a bruise. I've done it a full body to a person. So know their levels of Coumadin. That being said, like, that's prescription, right? But say you take a baby aspirin, right? That's fine. That's going to be okay. But maybe say you take 3 baby aspirins a day. That's going to be the same as one prescription. That's going to change your vascularity. Also, too, be aware of what is in your client's system when they come in, because if they're drunk, they're already going to be a little bit flushed, right? So maybe some cooling on them. Or I don't know. I don't take drunk clients, but also know, like, right, maybe they're on fentanyl or meth or weed. Just know what's in their system so that you don't have any surprise adverse reactions, and ask them every time they come in, have you had any changes on your medicine? Have you been healthy? Are you hydrated? Are let me know what's happening. So I don't like to be shocked. I've been shocked way too many times. I ask everybody now. All right, so if your person comes in with active lupus or Raynaud's or rheumatoid arthritis, that's a nerve situation. Warm only. Do not hurt those nerves any worse. If they've got impaired sensitivity or maybe hypersensitivity, like I've got impaired sensitivity in my fingers from holding hot stones for decades. I could pick up, chicken. Like, I have impaired sensitivity. So what I'm feeling, isn't always what my client's feeling. So you always want to test the tool, whether it's cold or warm, on the inside of your wrist before you touch them. All right, you guys, let me see. I think that is everything that we need. Oh, I know. We're just going to talk real quick about how to warm and cool these. This is the way I do it anyway. And I work with a lot of steel tools. So I've got these and these. I also use the steel gua sha. I've got my steel dermophiles, steel rollers, and so forth. So the way I do it, the way that works best for me is if it's in my hot towel cabinet, it's too hot, even for my sensitivity. So I've got this wonderful little, this is a clam right here, and it's a warming plate on top and a warming plate on the bottom. And so it warms my stones. So I've always got those ready. And then I just set my tools in here. And this works to the perfect warming temperature for me. So again, as soon as I come in, I turn my clam on, I put my tools in there. You absolutely can put it in your hot towel cabinet. Just give it about extra couple minutes, because once they get over hot, it takes a good while for them to cool down. So you don't want to, wait too long and then they're not warm enough. Anyway, this is my clam. I love it. I stick everything in here. And then I'll do a lot more cool work during during the winter, summers when it's hot here. I'll do a lot more cool. And the way I keep my coolers, you can do a bowl of ice water, however you want. But for me, I take these, I put them in a freezer. They're just those little beads. And I get 2 layers of them. And then I'll just place my either rollers or the mushrooms on here, and I'll place this on top, and then they're going to be just nice and cool for me when I'm ready for them. I like to kind of have everything ready for me so that I don't have to, get in and out of my this and get out of my fridge and everything. I like to just have everything right there. So I like to have my tools ready and at the right temperature. Again, it tested on the inside of your wrist. It can be used with any product that you have. All right, you guys, I'm going to go ahead and show you our technique, how we're doing this. Shauna, give me some stripper music here, baby. Okay, so we're going to be starting with the mushrooms. All right, this is the way I do it. We've got our subaxillary lymph nodes. So the first thing I want to do is just open up those vessels. I'm going to find the clavicle, right? That's that bone right here. And I'm going to start medial here, and I'm just going to do little circles. Now, I am always going to be moving medial to lateral. That means from the center of my body to the outside. I would never want to move it this way because I'm moving fluid medially. So I do this about 3 or 4 times. Again, if I'm using it warm, it's going to vasodilate everything. I'm above that clavicle bone. Once I've got that open, now I'm going to open up through the chest. So right here in the center, you've got your sternum. We're going to be starting with those rib attachment points just lateral to that sternum bone. And now I'm below the clavicle bone, and I just work medial to lateral, medial to lateral. And I'll usually do the same line about 3 times. Now, when I do this, I'm not having to push down. The weight of these is enough to cause that ischemic reaction. All right. When you're doing this, don't hold tension in your hands. Just keep it nice and loose, but stay in control. Keep your ergonomics up nice and tall, shoulders relaxed. All right. And so then I work it all the way down to the bottom of the sternum. So I am working it onto their boobage. After I've got this area cleared, now I am ready to move up to the submandible. Here I'm going to start with my lymphatic drainage for the lymph nodes. I'm going to start right underneath my jawbone. I'm on the underside of that jawbone, and I'm going to be doing little circles, nice and slow and easy out to the lateral edge. And then I'm going to be doing little circles down. I've already cleared everything below this, so I'm going to do it again. And I bring it across. Now this time I'm going to not come down to the same place every time. I'm going to come a little bit more forward, a little bit more forward. So each time I bring it across and then I bring it down. Where these muscles attach is on that clavicle bone here to here. So I need to cover every inch of skin across this entire area. And I'm going to do that in a lateral and inferior motion. All right. So little circles across. The only area that you need to watch out in this one here is your larynx, right? Steel on bone does not feel good. And when your client is supine, that bone extends a little bit. However, this is a real mobile, like you can kind of slide it side to side like that. So what I do is I'm going to be doing it down. I kind of push on the lateral edge, slide it out of the way, and then bring it down to the clavicle. All right. So I clear, 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 drop, drop, drop. Next, I'm going to be clearing. I've got some lymph nodes here. I've got some lymph nodes here. So I'm going to be starting right here on mentalis. I bring these together. Now, this is something that you need to know of, especially if your client has sensitivity issues with sound. They're going to be adding a little bit of a clink. So try not to have them clink, but get them close. And the more you do it, the more comfortable you'll get. So we roll across. And I'm going to do that several times. Now along here, I've got my depressor muscles, my mentalis, and then I've got my masseter muscles over here. So I am taking that bone and I'm doing a lifting circle, lift, 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 circle, lift, lift, lift. And then I'm going to take it across their lips, all the way across their top of their lip, all the way across. And then every 2 or 3 strokes, I'm going to do a little stroke down. And I just kind of want to keep that flow going. All right, so say they've got some sinus congestion. Next, I'm just going to do, these kind of have a little bit of an edge on it. I'm going to scoop under that edge so that I'm kind of scooping underneath that zygoma, glide across the arch. All right, and I'm just going to do that a couple times. It's going to contour, and it's also going to drain their sinuses. If you use it warm, it feels pretty darn amazing. All right, so we're going to jump over that bone, and now we're going to be coming into some sinus drainage here. So a lot of people, like doing a circle around their eye. It's not really going to be feasible with these. They're going to clink together, and you're going to knock into their bone. So you're going to start medial. I again start on the edge. I kind of sweep down the nose, and then I bring it out and flush it down. Bring it out, flush it down, bring it out, and flush it down. All right. Next, I'm going to be warming and flushing their temporalis. All right. So it's the one that gives you the crow's feet. So starting medially, I'm going to go up and down, softening those crow's feet. I'm going to take it all the way out to above the ear, and then I sweep it down. Up and down, softening the crow's feet. Take it over the ear, behind the ear, flush it down to the clavicle. And again, I'll do each of these 2 or 3 times. That's going to take me about 2 or 3, through about 3 minutes, and I should still have warmth at the end. Next is going to be my superior sinus. So I'm going to bring it out, bring it out, bring it out, and then I want to flush it down. And then on the forehead, I can either go this way. Now the striation of the muscles is this way. So if I'm going in this direction, I'm cross fibering those muscles, right? I'm stretching them one way. Or I can go up and down, and that's going to be linear to those muscles. Or I can do kind of an S formation, and that's kind of a combination of linear and cross fibering. Regardless, here I'm just kind of looking to move those muscles and flush out any metabolic waste. When I'm done, I bring it down. On that note, when you're doing these, if your client has Botox or fillers, you need to wait a couple weeks, all right? Because if we come in with warmth and they just had fillers, say 3 days ago, we're going to be spreading it out, and they pay too much money to have it spread out. So that's something you definitely need to ask every time. All right, so for the jaw massage, using the mushrooms is just like we did with our fingers. So it's just a small circular motion, and you want to stay into the meaty areas. It doesn't feel good on the bones. Now, another thing you can do is hold the pressure and have them open and close their mouth. Feels really, really nice. Regardless of what you do, you always want to finish it with a flush at the end. All right, so that's how I do my steel magic on that one. For the steel rollers, it's the same, right? So here, sorry, I only have one of my steel ones here. Here, I'm going to take it and I'm going to be above that clavicle bone, and I'm going to just start with a little roll, 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 and I do that 2 or 3 times, starting right here in the center. And it's just kind of an opening of those lymphatic vessels, allowing it to drain down to my chest. And again, this can be done with no product or any product of your choosing. Once I've got that done, now I'm going to come back to here, starting below it, right? I'm going to roll, 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 slide down, roll, roll, roll. All right, the striation of my muscle is this way, so I'm cross fibering these muscles as I do this, coming out to that subaxillary lymph node. Take that one all the way down to the boobs, and then I like to take this for submandible. I bring it across, I roll it down. I bring it across, I roll down. And again, I'm going to straddle that trachea. Once I've got that, starting at mentalis, I'm going to be lifting up, up, up. And I do that 2 or 3 times. These are my depressor muscles, and I don't want them depressed. I want them lifted. Working that big meaty muscle. I'm taking it from the superior edge of my mandible to the inferior edge of my zygoma. All right. And then one thing I like to do is I'll put like a lip mask on them using this tool warm. I'll bring them a little stretch and I'll go back and forth it. It's just going to soften and kind of puff up any vertical lip lines. You can also do that bilaterally. You can use it warm or cold. Next, I'm going to kind of decrease their resting bitch face. So I'm going to grab the corners of their mouth and I bring it up. Next, I want to drain their sinuses. I like to use the smaller side for this. Next, I want to drain their eyes. I use the smaller side for this. Medial to lateral. I'm just rolling off the puff. I teach them how to do this at home as well. Next, I want to soften temporalis, headaches, perfect, warm or cold. All the way back to the ear. Glide it down. Everything I do is 3. And I roll it down. And then I do a third one. Next, I'm going to go into my superior sinus cavity, starting right here at the center. And I'm going to roll down. Roll down. All right. So again, here, we can go this way. I'm going to be starting and kind of moving superior, right? That's going to be in a cross fiber and a lifting fashion. Or I can do it lifting it. This way I kind of like, because I get to roll back into their meridians. And it feels really nice. Or you can do that cross fibering technique, and I do it with a small edge where it's going to be crisscross. And when I'm done, I always finish with that lymphatic flush. All right. So again, these techniques can be done any part of your facial with any product on there. So mixing it up. So say I've got a peppermint mask that's a cooling mask. I'll apply a cooling product to them and use a warm tool on them, or I'll put a warming mask on them and use a cool tool, or an oxygen mask with warm, or an oxygen mask with cold. However you want to mix it up, it's going to feel amazing. Your client's going to be like, oh, what is that? That feels good. So if you're not comfortable doing it bilaterally like that, just do it on one side, right? It feels really, really nice. But I recommend having two tools so that you can alternate, grab the warm tool when you're on the other side. Okay, gosh, that went super, super duper quick. And so I have a client, so I've got to go. But if you have any questions or concerns or special situations,
They do.
if you, okay, I will get to them after work this evening. Is there a way I can do that, Shauna?
Yeah, I'll give them to you. There, some of them you have answered, so I can answer some more of these. Okay. Yeah.
Okay, yeah, I got a client like
What's
in
your
5 minutes. I'm so
favorite
sorry.
tool? What's your favorite tool, Zen?
My favorite tool, mushrooms. I use these for everything. Like I said, just that sustained heat, like it's just magic. It just melts muscles. So I do a lot of like massage with it, right? It's better than using my fingers. It just creates that warmth and it softens it. It holds the heat better than my stone. So yeah, this is 100% my favorite tool. And yeah, I always incorporate a lot of sound baths to it. So yeah.
Yeah. And where's the clam from?
Amazon, yeah. Just type in stone warmer. They're not expensive and they're so convenient.
Okay. Where do we find you? Where do we
So
find
I'm
your
at
classes?
the Zen Lounge on IG. On Facebook, I'm Zen Miller. On TikTok, I'm the Zen Lounge. You guys, I've got tons and tons and tons of videos. I have a picture of me doing it on a client. So is there a way we can get them that video?
Yeah, well, you want to put it on YouTube?
Oh yeah. I'll just upload it to the Hale and Hush page, so you'll see what it looks like. Like it is important that you do it to yourself, so you can feel the areas that have, I'll definitely need to lighten up in here, and you can also feel the areas you can go a bit heavier in. Temporalis is one, your jaw is the other. But do it on yourself, get comfortable on it. Try it, that bilateral technique, try it unilaterally. Again, just really watching out, being aware of what medicines are on, looking for any distended veins or arteries. And yeah, if you have any questions, you guys, please let me know. It has been an honor to be here and present with you today. I can't wait to do it again. Miss Shauna, thank you for this opportunity.
Thank you.
Hale and Hush, thank you for everything. I am so grateful.
Nobody go anywhere. We got to give prizes away. Thank you so much, Zen. It's eye-opening.
Namaste.
Did anybody else make face? Oh, you can't see it. Oh, there. Face photos. Yeah, I did. Because
I'm gonna say one more thing. So this manual Shauna has. So everything that I said today is on here. If you have any questions, let me know. All right. Thank you so much, you guys.
Thank you. Have a great day.
You as well. Bye-bye.
Bye. All right, guys, let me look at these questions because I think I can answer most of these myself. Amber, she told you how to warm up the tool. She likes to do it in the clam warmer. Here's another suggestion. My towel cabbie on top gets very warm. So I just leave my tools on top of my cabbie, not in it, on it. And someone asked what specific temperature. There is not specific. Make sure you test it on the inside of your wrist, not your hands. So you can, and I always ask the client, I put it right here on their shoulder. And I said, hey, is that temperature okay? Perfect, move on. Okay, so just watch your temperature. It is a trick. Some people take it hotter than other people, but we don't want it steamy hot. A lot of people put it in the towel cabbies, and that is too hot. Okay, I got that question. A lot of people, Lauren and someone else, Michelle, both of you asked about what time during the facial. It doesn't, you can do it anytime. She said with cleansers, with masks, with oils. She likes to do it in the beginning. She does a little bit of opening of the lymph nodes in the cleanse so that that system is already flushing that metabolic waste and just all of that under the surface. So you can do a little bit in your cleanse. In my cleanse, when you're cleansing the neck, and I always just cleanse, open the lymph node in my cleanse just to get it started. And then I usually use the tools in my masking portion because it does calm people down, right? I hope that is a sufficient answer. It's not a Zen answer, but it's mine. And JC, would it be advantageous to buy 2 sets of each? Yes. When I was seeing clients 9 to 7 p.m., yes, because one is always cleaned and ready to go and you can rotate them out. If you are swamped like that, definitely do that. But definitely notice she has 2 mushrooms and 2 facial rollers, and people come by the booth sometimes and just buy 1 mushroom, and I'm not sure what they're going to do with that. So buy 2. Okay. And they're really inexpensive. I've looked at them at shows. Ours are $15 a mushroom, so it's $30 a set. I tell you what, I've seen them for 50, 60, 100. It's really, Chris gets a discount. She gives a discount to you guys. So facial protocol, there's not, Denise, we don't really have a protocol because you can use it anytime, and we want it adaptive in our protocol. Her video, I'll try to get it on YouTube by the end of the week. Yes, tomorrow. I'm flying. I'll have Morgan do it. And make sure you guys, if you want her form, please email marketing at Hale and Hush so I can get that to you. Michelle, I think I got you. Tiara, yeah, I know she mentioned Scar Vision 8 weeks, but are there any classes? Yes, she has a class on that. Go see it. It's amazing. I actually did it on a client. I almost used it in a competition in the skin games. It's pretty amazing. Ruth, we have the tools at Hale and Hush on our website, and her classes, it's Zen Lounge. You guys can find her. She's really easy to find everywhere. You're welcome, Michelle. Thank you. I was just able to log in. Yes, Yvonne, you'll get a recording. And Andrea, email me, email Hale. I'm sorry. Let's start over. If you need the Airtable link to this document, Airtable is marketing at haleandhush.com. Okay. If you, now I'm just randomly, when she was talking, I closed my eyes and I scrolled up and down the class list and I got some winners from some oil. It's probably not the best way, but this is the way we got today. Okay. So if you're still on here, I need you to speak up in the chat right now. Alicia Castillo, you won the first gamble of my mouse. Are you on there? Now, if you want the prize, email education at haleandhush.com with your address, full name and address, okay? And then my second scroller was Cindy Jarvis. Are you still here? Anybody? Cindy, you here? You, email me. Okay. And my third scrolly, I feel like it was like that wheel on Price is Right, was Gina Taylor. Gina, are you still in here? Gina? Gina? Yes, email me. And since it was kind of crazy, I just drew 2 more names because you guys know I love this, right? Okay. Julie Roberts, are you still in here? Julie Roberts. Julie? Yay, okay, email me. And Susan Silmy. Susan, you still in there? Sorry, I tried to do it as random as I could. Susan, did you log off? Do I have to pick someone else? I see your name. Are you there? Uh-oh, hold on. Susan might be gone. Did you guys like that today? I absolutely love Zen Miller. Anne, call me. I wish I could call you too. Susan, she's still there. Okay, everybody was here that won. Send me your full name, your address, and I'll get you some Remedy Rehab oil. In her video that she's talking about on YouTube, she's using the Remedy Rehab oil. So it's really awesome. As soon as she sends it, we'll get it up. Okay. I don't have the original. I just have like a piece of it. So let me email her and make sure. That clam warmer's on Amazon under stone warmer. You guys see that? I'll get the YouTube video up and I'll go upload her document to the Airtable right now. If you already have the link, you're in, go get it. I'll make a new tab that says forms or documents. If you're not, email marketing will get it to you, and I will be sending the replay of this to you. Someone has their hand raised. Do you need me? Who is it? Susan. Oh, because you're here. Okay. Perfect. Perfect. Oh, the clam warmer. Denise, you are worth $1 million, girl. Thank you. So next month is going to be on a hierarchy of treatments and exfoliants with Angela Green, and she partners with Pamela Springer for Global Skincare Solutions. They do a lot of peels on skin of color. So we're going to bring that in next month. And then the following month, I think, is our collaboration with Niche Services. And so we collaborate with Face Reality for acne. What's after that? Sugaring, waxing, intimate treatments. I forgot. The list goes on and on. You guys know I had them on the thing. There's no discounts on tools ever. I'm sorry to say that, even at shows, nothing, because she does mark them so inexpensively, Rebecca, that they're already discounted, trust me. Because I saw a pair at a trade show just 2 weeks ago, and they were $55 for the same steel. So there's that. And ours are only 30. Okay. So awesome. Jessica, thank you. Jessica, I got you what you needed, right? You needed something from me. Did we take care of that? Okay. We're doing, Rita, we are going to do classes at the end of the year in fall with Terry Wojak about the advanced aesthetics. Yes. And not in Wyoming. Wyoming just did not work out. So I was sad about that. Yes. Thank you, Jessica. Let me see. There's a couple more questions. Amanda, sign up for what, girl? Oh, Julie's on it. She just emailed me. She wants her oil now. Okay. Sign up for what, babe? Do you mean sign up for the webinars or any of our classes? Go to our website. If you want Zen's classes, you have to find her on social media. It's the Zen Institute for Learning. Yes, Eileen, let's talk about cleaning those steel tools. I use very good heavy duty dish soap to clean them. And sometimes I put them in the little air, the thing, the UV, the UV little thing I have that kind of sanitizes them. But the stainless steel is not porous, so it does not hold the bacteria. Just make sure you really wash the little rings around the roller. Okay. And alcohol, you can just have an alcohol wipe and go over them with alcohol too. Amanda, sign up for the classes for us, for our webinars. Our free webinars are on the website right now through July. Go do it. Amanda, thank you. Yes, and recommend, I got that one. Did I miss anybody's thing? Yvonne, I will be in Orlando and I will be in Las Vegas. I'm going to the Esthetician Summit. I leave tomorrow for Dallas again. So I'll be all around. And I'll be also a Sacramento show. I'm speaking on the live stage. If anyone's in California. Andrea, you are not emailing. You're emailing. If you want to be on this list to get in the Airtable, I need your full name and your email to the marketing email. The marketing email is how we sign people up for the Airtable. And in Las Vegas, yes. Everyone, please come by and say hi. I don't see your faces. You only see mine. So, oh, Tanisha, come say hi to me, girl. See you in Texas. See you tomorrow. Well, I'll be there tomorrow. I'll probably see you Saturday, right? Tatiana, I'm always on the road again, right? Andrea, only for the Airtable. That's what you're emailing marketing for. Do you need a TH? No, I talk enough for everyone. Can't you tell? Victoria, thank you for joining. Laura was on here. My other training team, thank you for joining. Victoria Wig. Andrea, can you please say what is that? I don't know what you're saying to me. The Airtable, is that what you're asking me? I wish you could talk to me. Courtney Fung, where have you been all my life? Haven't seen you for so long. Hey, I'll be up at Spectrum on May 3rd for their alumni little event. I'm so excited about that. I felt like I was special with the invite. Michelle, I got your email, but with not certificate attached. Oh, can you email me again and let me know that happened? I hate to tell everyone I am not perfect and neither is technology. So things happen all the time. Thank you. Yes, the Airtable. So Andrea, in the Airtable, let me check out if I'm missing anything. Okay. In the Airtable, that's what holds our free monthly facial program. It holds all the documents and the reels and stories for that. It holds all of our website. Sarah just signed up. Thank you. It holds, oh, so does Lorena. Thank you. It holds all of our logos and website photos if you are going to sell our stuff online. It holds all free monthly marketing, which our social media girl makes stuff for you to use in your own room, stuff we don't use. It's pretty incredible. And then now I'm going to open a documents file in there for documents like this that people need after class. So the Airtable link has a lot of awesome free stuff in that. And you keep the link and you just utilize it every month because we update all the time. Like I think in a couple days, the May facial is going to hit. Okay. Brooke, it's this document that Cheryl made that goes through everything she just said because she talks real fast, girl. You're not listening. You missed half of it, right? So I'm going to get that document on there in just a little bit. I have another meeting right after this, so then I'll get it done. Okay. Everyone, you have a great day. Oh, I do love these webinars too, Austin. Did you sign up? Oh, there's a new one that we just added, Linda, about if you guys are into Reiki or attune products and how to bring gemstones into the treatment room. She's coming up May too, May 2nd, I think. So that's a new one we just added. Go ahead and sign up for that. And that's the stuff I'm talking about at the Sacramento show later this year, is how to infuse gemstones into the treatment room. Some people love it. Some people think it's witchcraft. Just pick your side. It's fine. Everyone does their own thing, right? Oh, I'm so glad, Austin. So the next one too with Angela. So we have one with Linda and then one with Angela Green. So it should be amazing. Who do we, Amber, for who? Contact for what? Where are you? I try. Tina, thank you. I try to give you guys as much as we can, as much cool things as I can find, and the cool people that'll work with us. Perfect, Dolores. Just sent to Mark. Perfect. Yep. Good job. So I'll get those sent to you guys as soon as I can, okay? I just have a meeting. I'm happy I'm glad you did too. They're fun, and we always give prizes away. It's fun. Okay, someone asked me a question. Amber, what do you mean contact Taylor? For the for the overview calls, the welcome calls? Where's Amber? Can I make you talk to me? Amber, I'm turning your mic on. Can you talk to me? There you go.
I was just wondering where the marketing email is located. Is it Taylor's email or a different one?
No, it's marketing at haleandhush.com. It comes to me. It's just in a separate email, and that's where I send the Airtable link from.
Okay, thank you so much.
You're welcome. Thanks for chatting in. It's nice to talk to a person.
Nice to talk to you as always, Shauna.
I know. I'm so excited. Where are you from, Amber?
St. Pete, Florida.
Oh yeah. But it's warm and beautiful.
Oh, it is very warm and beautiful.
Oh, I know, I'm jelly. It's pretty here right now, but it's still cold. Still cold. Okay, everyone, have a great day. I'm gonna sign off. I will be sending you the link if you want to rewatch this webinar. That's great because Cheryl talks real fast. I'm serious. I have a really funny picture. I don't know if any of you took notes like I did. Whoops, there. Can you see it now?
Yes.
There's the face, the body's the face. I'm not a good
Looks like
artist,
mine.
but you know, it gets it through. She's taught me a lot. Some of it, you know, everyone does their own thing. Some things people agree with, some people don't. It's fine. Whatever. Do your own thing. Okay, thank you guys. I will see you next month. 2 webinars next month. So go sign up. Have a great day.